Switching your attention to the movements of breathing in the body. So you might notice the chest, bringing your attention to the front of the chest, the ribs and the breastbone. But also then to the sides of the chest, from the armpits to the lower ribs, from the lower ribs to the armpits, left and right. And then is there any sensation of the movement backward, perhaps in the chest, maybe at the lower ribs? Often it's easiest to feel movement there, or up between the shoulder blades. And on the one hand, the spine is more toward the back of the torso, so you've got those big bones there that might affect the movement with breathing. But the diaphragm attaches to the spine, and the lungs are more in the back of the chest, so the movement backward might be possible, and we'll explore that. Good, and then bring your attention to your abdomen. What movements do you feel of the breath in the abdomen? That's good. You might feel in the front, above and below the navel, above the pubic bone. You might feel the breath to the side and noticing how the breath might change. And then again, is there any movement backward? Into the lower back, above the top of the pelvis. And then the pelvis itself, the sacrum there, that wedge-shaped bone, the base of the spine between the wings of the pelvis, the iliac crest. And maybe even down into the pelvic floor between the sits bones. And as one breathes in, sometimes the pelvic floor lowers a little bit with the intra-abdominal pressure, especially if you were lying down. In sitting, sometimes there's a little lifting in the pelvic floor as a response to maintain that pressure in the abdomen, protect the organ. And, just bringing your attention somewhere and learning how to shift the attention. So if you can't feel something somewhere, if it's not comfortable, that's okay.